I'm going to do an Instagram live, but I'm very conscious that I didn't do one last week. It's now 6 p.m. in Perth, and I've got a dinner with some urologists, so doctors that specialise in kidneys and bladders. Really important because I'm at their conference now in Perth, having had the most amazing time in Sydney. So I thought I would do this now, just give you half an hour of insights actually, what I've learned since I've left England, because it's been an amazing, incredible week actually. I went to Singapore for 3 nights and did some work with Oslo Health, who's a company, did some presentations there for women and also for healthcare professionals. The healthcare professionals one was very interesting because some of them were a little bit reserved, thinking about me going, but actually there was a cardiologist there were accident and emergency doctors there was an ophthalmologist, an eye specialist there, and I opened their minds to thinking about hormones. We had a really positive discussion. It was incredible actually. And then I spoke a lot to women. It was a packed room. And actually what's going on in Singapore is amazing because they look after people really well. Singapore is very organised, it's very efficient, but they're waking up and realising more and more that women are living longer, but not actually so much in good health. Thinking about osteoporosis, thinking about how common that is in older people and ways to reduce it, thinking about how hormones can reduce osteoporosis is so important. And then I went to Sydney, and I've been to Sydney twice before actually, one many years ago and then one about 18 months ago, with the most incredible doctors, Dr. Carrie Cashel and Dr. Emma Harvey, who I met last time, and they said, wouldn't it be fun if we could do an event in Sydney Opera House? Well, isn't it great when women have ambitious ideas and women can work with others to actually make things done? And it happened. I feel like it was just a dream, but one day I'm going to realise that it wasn't a dream, it actually happened. So in Sydney, it wasn't just about Sydney Opera House. I did an event for women, mainly talking about surgical menopause, very emotional stories for women who've had surgery to remove their ovaries. Some of them had had cancer, some of them had had a family history of cancer. And the big theme that was coming through, that these women weren't given choice, they weren't listened to, they weren't spoken to about the possibility of having hormones to replace the missing ones once their ovaries had gone. We also then did a lunchtime event, some of you might have seen it on my Instagram stories, for lots of women, and that was very incredible. There were doctors there as well, but mainly women wanting to learn more, and we spoke in a panel, talked a lot about options for women. And it's been also personally amazing for me because I've met in real life some people that I've connected to over the years globally. So a lot of doctors, women, nurses, healthcare professionals from Australia, but also you will have seen I've met in real life 3 very special, incredible doctors from America. So that was Kelly Casperson, Vonda Wright, and Mary Claire Haver. We've connected, we're in a WhatsApp group, so we actually liaise most days. But isn't it wonderful to actually see people, hug them, feel them, talk to them, share stories, share experiences, laugh with them, cry with them, shout with them, get frustrated with them, feel empowered, feel invigorated. It was just incredible. So yesterday was the real highlight, of course. We were in the Sydney Opera House, like the most amazing building that everyone recognises. And I love connections, I'm quite spiritual. And actually 60 years ago, nearly to the day, my mother and father were on their honeymoon. My father was in the Navy, he was on a cargo ship, and my mother was the only woman, she joined them, and they went past the Opera House with its scaffolding on it being built. There's photos of it that she sent me. And who would have thought that their daughter would be there in front of 2,500 women talking about hormones? It was just incredible. So coming back to Sydney, coming to the Opera House, the most amazing time. What I found though was just the energy in the room. I was very privileged. I talked a lot about my own experience, about my own choices to improve my future health. And as many of you know, I have made many choices to improve my future health. I'm really scared of osteoporosis, so I do everything I can to keep my bones strong, but also I want my heart and brain to be as strong and as well functioning as possible. You will all agree that our brain is the most important organ in our body. Without our brain, it's very difficult to function. And I had about 8 months when I was perimenopausal where my brain wasn't functioning. I couldn't think properly, I couldn't think clearly, I couldn't remember things, I couldn't concentrate, I couldn't sleep. I was very angry, I was very irritable, I was very short-tempered. But I was also very sad, I was very joyless, I was very listless. I just felt empty. I wasn't enjoying who I was or who I'd become. That was only for 8 months. I'm very lucky because my daughter diagnosed my perimenopause. But actually it gave me an insight of how hard it is if your brain doesn't work. So I could educate people about the role of hormones in our brains, but also I not only take hormones at the right dose and type for me, including testosterone, but I also exercise regularly. Every day since I've been away, I've been doing yoga. In fact, I have my trusted yoga mat here. I take it everywhere with me because I can flick it out in the room and do yoga. And that's really important, to be able to focus, to do yoga every morning, end with my lovely headstand. It just really sets me up for the day. And yesterday was really important for me and I didn't want to mess up and let people down. So to help me get into the zone, to help me feel strong, to help me feel connected with my body and mind, yoga is a really important practice, especially that headstand. Having lots of blood flowing to my head, feeling very strong and empowered is incredible. So regular yoga practice, eating healthily and regularly, not drinking, not smoking, and as many of you know, I don't do caffeine either, so I don't eat chocolate, I don't drink caffeinated drinks. All of these things are helping, keeping me healthy, and it's a personal choice. I don't judge people if they don't do yoga, I don't judge people if they drink alcohol or drink or smoke, I don't judge people whether they take hormones or not. But what it is allowing people to choose, and that was what was really important yesterday. So I was talking, Kelly Casperson, who is actually, her second job is a stand-up comedian. She's very, very funny. Her sense of timing is just phenomenal. So she was talking a lot about sex, talking about testosterone, talking again about choice. Really clever, very good. And there was then Vonda Wright was talking about osteosarcopenia, this loss of muscle mass and loss of bone density that occurs as we age, and how important it is we remember that our bones and muscles are dynamic. They're producing chemical cytokines into our bloodstream, helping us function properly, and we need our bones and muscles to be as strong as possible as we age. And so everybody in the audience was feeling how important it is to exercise, especially weight-bearing exercises, and how awful it is actually if we let that slip. Mary Claire Haver was doing a lovely panel session talking about her work, talking about the stories that she's heard, talking about how important it is that women don't suffer. It's very emotional listening to Mary Claire Haver talk about her mother who has dementia and fractured her hip, and her grandmother who really struggled with urinary incontinence as well as poor mobility. I'm very fortunate, and even my mother was with me in Sydney Opera House because I showed a video of her talking about her being on HRT. And she was very fortunate because after my father died in 1979, she had a lot of symptoms she thought were related to grief. She didn't know what was going on, but her doctor just gave her a tablet which she took. The tablet happened to be Prempax-C, a type of hormones replacement therapy that contained pregnant horses' urine. It did the job. It helped her. It made her able to not only function looking after 3 young children as a widow, but also to be able to earn a salary and be a teacher. So I'm forever grateful for that male doctor, actually, who gave her hormones many, many years ago, and she still continues them. So my role model, my mother, is very inspirational. She's worked very hard all her life. In fact, she's only recently retired. She's got strong bones, she's got a strong heart, and she's got a very strong mind and brain as well. So it's important thinking about future health. This morning, before I left to come here, look at Perth, isn't it nice, by the way? I literally just arrived, so I haven't experienced anything, but this looks incredible. I was in Sydney, and the So Hot Right Now people, Kerry Cashel and Emma Harvey at the helm, had organised a healthcare professional meeting. So it was a conference for about 300 people. Frustratingly, it was mainly women, but it doesn't matter. They were women who were really inspired with the work that I'm doing and work that others are doing, and the knowledge that they've obtained over the last few years, like me, with their clinical experience. Their knowledge of the literature is amazing, and it's really helping women. So I gave 2 presentations. I gave one on individualisation of care. I talked around 2 women, 2 patients that I'd seen. One who had a lot of medical problems following her having had an oophorectomy at an early age. So this is a lady who had her ovaries removed when she was in her 30s, and no one had given her hormones back because no one had had that conversation with her. But over the last 10 years, she's developed osteoporosis, raised blood pressure, she's had a heart attack, she's had a mini stroke. She's also got osteoarthritis, raised blood pressure, raised cholesterol. So we were talking about how would it have been if she'd been given her hormones back right from the start. Like if I was a surgeon, I'm not, but if I was and I took out someone's thyroid gland, of course I would give them thyroxine because their thyroxine levels would drop. But too often women have their ovaries removed and no one gives them their missing hormones back. And we need to change that, of course, especially in young women. Then the second presentation I gave was about mental health and hormones. And I always find it very hard when I'm talking about mental health and hormones, and mainly because I was talking around a case of someone who actually did take her life by suicide, a lawyer who died because she was so sad and things weren't improving despite having had electroconvulsive therapy, despite having lithium, despite having quetiapine, despite having had 4 different antidepressants, despite being sectioned many times by the mental health team. She was still really, really struggling. And it's so sad. But in Australia and in the UK, suicide rates are the highest in women in their late 40s, early 50s, whether it's UK or Australia, slightly different, but still around that perimenopausal age. We've known for years that perimenopause, menopause, with the hormonal fluctuations, the decline in hormones, can affect mental health. Now that is so important that we remember that, because actually I see so many women whose mental health improves with the right dose and type of hormones. So it was very sad but very empowering, actually being able to share my knowledge, my clinical experience, but also my knowledge of neuroanatomy, neurophysiology, so the way our brain works and functions, the way the hormones work in our brain. So these are the natural hormones, how they work in our brain when we have them. Just going to move this because the light's really strong, isn't it? So how the hormones work in our brain is so important, but so many of us there today, but also me myself, weren't taught this at medical school. We were taught all sorts of things, physiology, biochemistry, genetics, but we weren't taught that our hormones, estradiol, progesterone, testosterone, can alter the genomic structure in our cells. They can affect the way our mitochondria, the powerhouse of our cells, function. They can affect levels of other neurotransmitters like dopamine, serotonin, melatonin, noradrenaline, adrenaline, glutamate, all these important neurotransmitters that affect the way our brains work and function. So it's no surprise that we've got an increased risk of dementia when we don't have our hormones. There's no surprise that we've got an increased risk of inflammation all around our body. But the big thing that I really wanted to share with you is that it's as sad here as it is in the UK, actually, because women are really struggling. I spoke to a lot of women outside the Sydney Opera House as I was walking, going back to the hotel, and a lot of them were crying, saying, you know, my work's really helped them. The podcasts, Balance app, has really given them a lot of knowledge, a lot of information, so they can make choices that they want. But they're being stopped. They're being stopped by healthcare professionals who are telling them that they can't have, or they shouldn't have, or they mustn't have hormones. And it's 2025. Like, we're talking so much about women are being over-medicalised, they've been given too much HRT. But actually we have to remember that minority of women are given HRT. Globally, it's 5% of menopausal women are prescribed HRT. Now, you wouldn't get that in any other medication, any other treatment in medicine, when the guidelines say the majority of women will benefit or the majority of patients will benefit. But we have something that really helps people. It helps them feel better, but it also helps reduce risk of diseases. Yet we're still arguing about whether women should be taking hormones or not. And actually women want them. Women want them more than they want antidepressants. Yet antidepressant prescribing is greater in Australia and UK and US than HRT prescribing is. Now, antidepressants have a risk of osteoporosis. Most of my patients who take antidepressants have never been told about the risk of osteoporosis. Women and men actually who take antidepressants have an increased risk of being unable to orgasm, to have reduced sexual desire. That's never usually mentioned to them either. Whenever someone is even thinking about HRT, everyone talks about risks or perceived risks. And I was talking today about genitourinary syndrome of menopause. So when people have urinary symptoms, when people have vaginal dryness, soreness, and at this urology conference I'm going to be talking a lot about urinary symptoms, of course, urinary tract infections. But when people have these symptoms, we have vaginal hormones. This isn't HRT, this isn't MHT, it's not systemic hormonal treatment. It's just very low dose vaginal hormones that are inserted in the vagina. And actually what I did before I came to Australia is I found the insert. You know, when you open the packet, there's an insert as a patient telling you the warnings. And it's very similar to the insert in vaginal hormones in the UK. It tells people there's a risk of a heart attack, there's a risk of a stroke, there's risk of breast cancer, there's risk of clot, there's risk of other cancers throughout this leaflet. And it's not told once, it's repeated over and over in different ways. So I had screenshots on my slides of all the warnings associated to vaginal hormones. And even progesterone, which I use a lot, in fact I use it first line for most of my patients, which is DHEA, so it converts to estrogen and testosterone in the vagina. It's a daily pessary. It can be transformational for people. And here in Australia, if the doctors try to prescribe it, there's a warning. It's the same warning if they try and prescribe diamorphic heroin. Like, how? It doesn't make sense, does it? There are so many barriers. So there are barriers for women, but there are barriers for healthcare professionals as well. In the UK, sadly, many women are really struggling to get HRT because doctors have been scared away from hormones. And it's got worse over the last 6 months because we hear it all the time from women. We get letters from our patients and emails saying that they are unable to access HRT, so they've been put on antidepressants instead. But over here in Australia, I feel things are different. I feel there's a lot more professional curiosity. There's a lot more dynamism. The doctors are really wanting to learn. They're really wanting to improve their clinical practice, and they're learning from others. I've connected quite a few doctors over here. They carry on meeting very regularly, and they're learning a lot from patients. They're looking at the evidence, they're looking at papers that are coming out. They're really amplifying how they are over here, but also helping with training and education. Menopause, hormonal disturbances, so perimenopause, PMS, PMDD, postnatal depression, should really be treated in primary care. So most of the people today were GPs, but they had this real thirst for knowledge. They had a real appetite to improve things. And I've said many times, I wish I could go back in time. I wish I could be thinking about all those patients that I didn't diagnose properly, that I didn't treat properly. But these people are so privileged because they're still working as GPs. They see the women with palpitations. They see the women with bladder pain. They see the women with dry skin, dry eyes, sore, burning mouth, tinnitus. They see the women with pins and needles in their legs. They see the women who have irritable bowel symptoms, and they're always thinking about hormones, and they are transforming their patients. They're enabling them to feel better, and they're also helping their future health. In Australia, people generally seem to be healthier. They take exercise a lot more seriously. They seem very sociable. They look after each other. when we had a standing ovation at Sydney Opera House, which was incredible, women were just together, really united, and really special things happen when women connect. And we do get that in the UK, but not so much. There's a lot more people trying to push people down. Whereas so much, if we lift each other up, we can all grow taller and stronger together. And that's something that I think is so important when we think about hormonal care. Just because I've got good treatment doesn't mean that I can just gloat. I feel very strongly as a patient that I should enable others to have similar knowledge to be able to make choices that are right for them. As a doctor, I feel very strongly that I'm a patient's advocate. So I can enable conversations, I can give them more information so they have more choices. The other thing that's so important is that people can decide for themselves. They can make choices for themselves, but they can also know that they can change their opinion as well. Because we all do. You know, I used to drink alcohol as a student and I loved it. But I don't drink alcohol now and I love not drinking now. Don't get me wrong, I've never had a problem with alcohol. I actually stopped drinking because my cardiologist told me to when I was 38 years old because I had palpitations. It was probably due to my perimenopause. No one thought about it. I didn't, but I stopped drinking alcohol. Didn't make any difference to my palpitations, but it reduced the frequency of migraines, so it was worth it for me just to try. But, you know, we're constantly making choices. We're constantly improving or maybe worsening our lifestyle. We're exploring, we're developing as people all the time. So if we make different choices about hormonal health, that's absolutely fine. We don't have to justify to anyone. What we have to do is internalise and think what's right for us today. Because life is so short, really, isn't it? We want to make the most of every day, and there are so many things externally that are stopping us be the best version of themselves. Whether it's because of the way other people are treating us, the things that we're reading, the worries that we have, what's happening with our children, our family, our friends, our work. There's always things that are constantly getting us down. But we can cope with them better if we're as strong mentally and physically as possible. And sometimes that is enabling us if we take hormones. Some of it is because we exercise in a different way. Some of it is that we have different friends. There's so much that can alter the way that we function. But one of my real take-home messages that I gave in the Sydney Opera House was to really be the best version of ourselves. We can all improve how we are. And sometimes it's quite a wake-up call. But I feel very strongly that if we're more selfish, actually, think more about how we can improve ourselves. We're improving our future health, but we're also improving it for others. What I'm realising is that a lot of the work that I'm doing is from the ground upwards. Of course, there's work that needs to be done higher for policymakers, for thought leaders, for government, but actually, we can't wait forever for things to change. We can't wait forever for different guidelines for new research because women are struggling every single day. What we can do is support people with the knowledge and information we have and allow people to deal with uncertainty so they can make choices. And that's why, from the ground up, we need to support and help each other. So many people do that already. I can see that through my Balance app, through the community that Instagram's created for us, for my podcast, for the feedback that I get. But we need to do it more because there are 1.34 billion menopausal women and there are a lot more who are suffering with perimenopause, PMS and PMDD. We can't keep waiting. We can't keep waiting for others to make changes for us. We have to do it together. And I feel that Australia is a great place to really amplify this movement. We've started things in UK, but we're being stopped a lot. But there's a lot over here. And I tell you what, these doctors are really strong, powerful people that work together to amplify things. So there are people that can help. But it's important that people aren't suffering in the way that they are because there's enough suffering in life. We shouldn't be suffering because we can't make choices about our hormones because we're being stopped. So quite a lot to go on there. I thought I would just do a bit of a brain dump because as you can see I'm super excited to be in Australia. It's only a week in, I've got another week, so I've got 4 nights in Perth. I'm doing 3 presentations at the urology conference. We've got 2 academic posters that I'm presenting And then I'm also doing an event in Perth for women, another event for healthcare professionals, and then I'm going to Melbourne to record a very special podcast with some amazing people, and then I'm flying home. So enjoy the rest of your week, and I'm sorry for coming on so quickly, but thank you for so many of you that have joined already. I will post it on my grid, and enjoy the rest of your day, your evening, wherever you are, and just think about how we can help more people to make changes happen a bit quicker, to reduce the suffering that's out there and improve not just our quality of lives, but our future health as well. Thank you.